Veno-occlusive disease is a relatively rare complication. In terms of pathophysiology, it has to do a lot with the endothelial injury, I would say, which is related, at least in part, to the intensity of the conditioning regimen, to the alloy activity, the use of calcineurin inhibitors, and many other factors. And we know very well that thanks to the approval of Defibrotide for severe VOD, now the outcome of these patients is improving. Of course, given the nature of this complication, it has been always complicated to get an early diagnosis. And this is why I'm very glad to see that the transplant community here at this EBMT 2024 annual meeting in Glasgow has embraced and started adopting the new EBMT refined criteria, which are allowing actually now, thanks to validation from different registries, to make the diagnosis up to 3 or 4 or 5 days earlier. And we know very well that in the field of VOD, the window really to intervene is around 2 days. So it's very important to be able to diagnose very early VOD. And this is where the refined EBMT criteria with this new entity of probable VOD are really being very helpful. And I would kindly invite the community to work on this and to embrace the use of these criteria. The other novelty we had during this EBMT 2024, I had the pleasure to present some sub-analysis from our Defi France registry related to VOD, and we focused on those patients who received post-cyclophosphamide for GVHD prophylaxis. And we know that this is really increasing and has become the backbone for GVHD prophylaxis, not only in the haploidentical stem cell transplant setting, but even beyond with other stem cell sources and donors. And what we noticed is that actually with post-Cy, you may have slightly more VOD, probably more severe, and that is actually scientifically logical because actually you're adding another high-dose alkylating agent, and we know that high-dose alkylating agents are a risk factors for VOD. Interestingly, the diagnosis is delayed by around 4 to 5 days, and also this is quite logical because you're giving high-dose cyclophosphamide at day +3 +4 or day +3 +5. Also, we see a little bit more very severe. So that brings me to the fact that while post-Cy is a true game changer in the field, we need to be aware that there are some specific toxicities connected to its use, and this is where VOD should be taken into account because we're adding a specific risk factor. And again, the key message is about early identification, early intervention, then you will improve the response rate and of course the survival of these patients.